Hello and welcome to another video in Foundations of Maternal and Newborn Health. In today's video, we're going to be talking a little bit more about preeclampsia and eclampsia. And what some of the warning signs are and why these warning signs are caused given our understanding of the mechanism of eclampsia. So again, we're going to be talking about warning signs. Warning signs. And in the last video, we talked about how eclampsia and preeclampsia are largely kind of caused by really high blood pressure. And we talked a little bit about what blood pressure is, how when your blood pressure increases, it's kind of like putting your thumb on a faucet that's turned on, a sink faucet, or on a hose that's spewing water. And when you put your finger over that hose, you increase the pressure of the water, of the liquid inside of your faucet or your hose, and liquid starts kind of shooting out. And so that higher blood pressure causes a lot of problems within your body. So the blood moving around your vessels are like the water in your hose or in your faucet. And that higher blood pressure can cause a lot of problems. So of course, the first warning sign of preeclampsia is just high blood pressure itself. So if a patient comes in and has really high blood pressure, that's immediately a sign of preeclampsia. And so a common cutoff, not always, but roughly 140 over 90 is a big warning sign of preeclampsia. So if someone has a 140 over 90 or even higher, you should immediately be thinking potentially preeclampsia. That should be kind of one big scary thing on your differential diagnosis. So high blood pressure is your kind of first warning sign, but this high blood pressure causes a lot of other problems in the body that we can actually use to warn us about preeclampsia. So one of the first is headaches. So if a woman comes in and has really bad headaches, you might think about preeclampsia. Of course, there's a lot of things that cause headaches, but again, it's about these warning signs. It's about getting kind of a bigger picture, so seeing all of the symptoms and whether they all kind of line up with this picture of preeclampsia. So your brain has a lot of small blood vessels in it, and this really high blood pressure actually causes a lot of those small blood vessels to burst open. And these can cause brain bleeds or swelling, and we'll talk a little bit more about swelling as well. But the swelling within the brain or these small brain bleeds can lead to headaches. And if they get bad enough, they can lead to seizures. And I'm not sure if this was mentioned in the last video, but the difference between preeclampsia and full-blown eclampsia is these seizures. So once you start having seizures, you're no longer preeclamptic, you're full-blown eclamptic. You have full-blown eclampsia. So headaches and if it gets bad enough, seizures. So the idea is that you treat the preeclampsia before you start developing these seizures, and so hopefully your patient or your client comes in with high blood pressure and maybe some headaches, and then you treat the hypertension, you treat with anticonvulsants, hopefully to prevent the eclampsia or the preeclampsia from getting to full-blown eclampsia with seizures. But again, these headaches and seizures are caused by this high blood pressure. So swelling and small brain bleeds cause these headaches. So the next common issue is issues with vision. So a patient might come in with blurred vision. So blurred. So it kind of looks like they're, even when they're on dry land, it might look like they're kind of looking through water. So it's kind of blurry, or flashing lights. So, there is no no light being turned on and off. Maybe they're in a dark room, but they're seeing kind of flashes of lights. These would all be kind of issues with vision that can be caused by really high blood pressure. So again, if a patient comes in with kind of complaining of issues with their vision, again, you want to be thinking about eclampsia or preeclampsia. And so again, the eye, like the brain, has a lot of these really small blood vessels. And so when the blood pressure gets really, really high, again, you'll get swelling or even small bleeds within the eyeball itself. And these issues, these bleeds or swelling, can lead to these effects that we see in vision, so blurred vision or flashing lights. So another common issue is issues with the kidney, and it's a problem known as proteinuria. And so this is an important one to remember, so make sure you remember proteinuria from this video. But basically, we haven't really talked much about the kidney, but the kidney filters out a lot of the bad stuff in your blood. It cleans all of your blood. And so when blood comes kind of from the body into the kidney filters out some of that blood and turns it into urine. So blood comes in and then urine comes out. And not all of the blood gets turned into urine, only some of it does, and some of the blood returns back to the body. But if your blood pressure is really high, if you have really high blood pressure, too much of your blood gets filtered out into your urine. So you actually have too much blood filtering happening. And so you get excessive proteins in your urine. And so that's where the name proteinuria comes from. So this is too much protein in urine. So too much of the proteins from your blood end up getting filtered out by your kidney, end up getting taken out of your blood by your kidney, and you pee it out, or it ends up in your urine. So again, this is a side effect of really high blood pressure. So the last one that I'll talk about today is edema. And this is also known as swelling. And so we talked about how you can get swelling in your eyes or in your brain from this really high blood pressure. And in the last video, we talked about vasoconstriction. But edema or swelling is caused by your blood vessels being a little too leaky. So if this is kind of a diagram of a blood vessel, so you have blood kind of coming in one way, coming out the other way. Usually your blood vessel lets out a little bit of blood into your tissues, a little bit of blood. And it's not necessarily whole blood, but it lets out a little bit of the liquid from your blood into your tissues. But when your blood pressure is really, really high, and again, you can think of it like putting your thumb up against a faucet or a hose, the pressure inside is really, really strong, and actually too much blood leaks out into your tissues if your blood pressure is too high. And so you can imagine in your hands or your feet or your face, if your blood vessels are too leaky, it ends up becoming really swollen. And so you'll end up with really swollen hands, really swollen feet, or even swollen face. And this is caused by, again, too high of a blood pressure. So this is edema. A lot of women have edema during pregnancy. It's very common. So that by itself, or headaches by itself, wouldn't be enough to give a diagnosis of preeclampsia, but you might, if they do have really bad edema or they do have really bad headaches, you might want to do a workup for preeclampsia. So test their blood pressure, ask about their vision, maybe even test their urine to see if they have other signs of preeclampsia. So again, this edema is caused by leaky vessels from high blood pressure. Or at least in this case, it's from high blood pressure. You can get edema from other ways, but in this case, that high blood pressure causes the vessels in your body to be leaky. And so usually you'll see swelling of your hands or feet, or in some cases even your face. All in all, the whole point of this video is just to give you some idea as to why we see some symptoms or some side effects of these diseases based on their underlying mechanism. So in this case, preeclampsia causes really high blood pressure, and this high blood pressure has a lot of knock-on effects inside the body, everything from the brain, like headaches and seizures, to your eyes, like vision, issues with your kidneys that causes proteinuria, or issues with your vessels that causes edema or swelling. And so all of these problems are just caused by high blood pressure, but they can tell us a lot more about a patient, whether they have this disease or not, based on their symptoms that they're having. So these are all sort of warning signs of preeclampsia to look out for in your patients.